Hello, welcome to another episode of Vital Talks. Multiple reports have it that most men, both young and old, still perceive contraception as a woman's primary responsibility. This attitude is unfortunate. But since the burden of pregnancy affects both partners, it is important that men and women share the burden of contraception equitably. On this week's episode of Vital Talks, we talk about contraception, why women must take full charge of their reproductive health, and the vital role of men. We'll be right back. Welcome back. Thank you so much for joining us on this week's episode of Vital Talks. Having a baby when you're not ready can put brakes on your career or education. That is why it is important to be informed and take advantage of existing methods of contraception. And this week, again, we have the very well-read Dr. Lilian Banmi, who is joining me to talk about contraception and to educate young men and women on why they should take full charge of their reproductive health. Doc, welcome.
Thank you.
Thank you for honoring us again and again.
You're welcome.
Thank you. I mean, in your years of practice, I'm sure you must have come across a lot of women who come to you for contraception.
Oh, many women come. In short, contraception is what? It's from a Greek word that means against.
Yeah, contra.
Yeah, contraception, sepsio, against conceiving.
Conceiving, yeah.
So you aren't yet ready to bring forth a child. Those are methods, you call them, the contraception, it's also called family planning.
Of course.
So these are methods that you use to plan your family. It means that you use these methods so that you'll be able to have a child when you want to.
You know, what really inspired this episode is a screenshot of a conversation I found on social media. I'm going to read it meticulously and we are going to pick up from here. I saw this on one of the blogs on Facebook, and this is what it says. This is the girl. Apparently, this lady got pregnant for her boyfriend and it didn't turn out well. The lady said, "I did a test, it is positive." And this is the guy's reply. "Okay, good news. I no get problem, but I no ready. Them born our house for this struggle. So as I stand, I no get place for put head." And the lady replies, "But I told you that you should not put it inside. I told you to pull out." Pull out how? This is the guy's reply. Pull out how? So when you see me time where I be shake the straightened foot, it's funny, but it's not funny because this is actually pathetic.
Yeah.
When you be, okay, let me take it. So when you see me time where I be shake the straightened foot like man way the mortuary, while you no push me, you be feel say I be getting an epilepsy or jengu, you instead hold me tight. And yes, what the lady says, "You can't be possibly serious. I can't be a single mother, God forbid." So that I will be under this giveaway section in all platforms. You need to be responsible. You put us in this mess. Clean it, or I will drag you on the media. And the guy says, "You know, drag me, remove from your body. You close your eyes, open leg. Drag me, mom. I be fugitive. I did Nigeria for take my refugee card. I stand for line. We go talk after I beg." It's sad because this is something that could have been prevented if this lady was taking going through a contraceptive method. Yeah.
What you need to understand, many people don't know that family planning methods, you have both natural and artificial methods. So what the lady was trying to explain to her man was a natural method,
which is
called coitus interruptus.
Okay, the pulling out method.
The pulling out method,
yes.
Or the withdrawal method.
Okay.
Now, this is, if you want to look on the contraception scale, it is the least effective method as far as contraception is concerned, because you have more than 30 pregnancies per 100 women that try that method. Now, it's a method which needs a lot of consultation between both partners.
Yes.
And it's a lot of willpower from the man. Especially. The man has more control over this method than the woman.
Yeah.
But one thing we also fail to understand, and why we have more pregnancies too, is the fact that there is a pre-ejaculatory fluid that contains sperm cells.
And that can actually cause pregnancy.
Thank you. That is why the rate of pregnancy with that method is extremely high.
So it's not an effective contraceptive method.
It is the least effective contraceptive method.
I mean, do you have men who actually come to you to get contraception for themselves or for their partners?
Of course, men come, but you have mostly women.
Yeah.
And men come mostly to get male condoms. You know, we have female condoms, we have male condoms. And one thing you need to understand is that like Maputo protocol, which emphasizes on the woman to take the responsibility of her reproductive and sexual health into her hands.
Very important.
It's so important. As you rightly said, the consequences weigh more on the woman.
They do.
Than the man. So I bet the woman should take more responsibility on her side, you know, to prevent any unwanted pregnancy.
So exactly, Doc, tell us, how can women take full charge of their reproductive health by using different contraceptive methods?
The interesting thing about contraception is that it is unique. It is individualized. Meaning what? The fact that I'm using a method doesn't mean that that method is going to go to for you. So I cannot take my method and recommend it to you without you having been consulted by a medical personnel.
Yes.
You should realize I said personnel are not necessarily a doctor, because we have few doctors that can do that.
Okay.
More and more medical personnel providers or medical providers have been trained on family planning methods.
Yeah.
We have the natural ones, as I told you, and we have the artificial ones.
Yes.
The natural ones, or they call the traditional ones, are less effective. Because like we have examples of natural or traditional ones are like the withdrawal method.
Yeah.
You have the fertility awareness method, where a woman is going to count her fertile periods. You have the other one, they're going to count the milk, they're going to check on the mucus, the consistency of the mucus. Those are all natural methods. You also have exclusive breastfeeding for first 6 months. Intensive exclusive breastfeeding. That is, the child breastfeeds at least 10 to 12 times a day. For the first 6 months, I repeat, first 6 months, because after 6 months, it's no longer effective. Exactly. But that method is very effective if the woman actually fulfills that. Now you have the artificial methods. Those are the methods that now people will mostly come to the hospital or medical centers or health centers to seek. You have different types. You have the pills, you have the injectables, you have the implant, you have the coil, then you have a permanent type. You need to understand that contraceptives are reversible and irreversible.
Okay.
The irreversible ones, we call them the permanent type. So before a woman or a man undergoes a irreversible contraceptive method, it has to be, the person has to fulfill certain criteria. For example, in our context, in Cameroon, for a woman, she has to be at least 35 years of age, in a stable marriage, has both sexes of children.
Okay. Interesting.
So they give at least,
if she's 35 years of age and not married, she cannot be granted that method.
That permanent method. And the permanent method is what we call tubal ligation, where they cut the tubes.
Oh, I get it.
Yes. No.
But someone could decide never to want to have children. Why does the law or the medical profession prevent them from getting that kind of contraceptive method?
That they don't want to have children.
Yes, they don't want to have children. They just want to enjoy their life, maybe pursue a child-free career.
Because the rate of regret is very high. So we have long-lasting acting methods like the coil, the implant.
Okay.
It can be put
such
for
that
you.
If you change your mind in the course of it, you can be taken away.
Exactly. For permanent methods, we are not in a hurry. No. We have long-lasting acting methods that you can use. And whenever you change your mind, you're free to go without having regrets in the future.
Okay. And I'm sure these different artificial contraceptive methods have consequences.
You call them side effects.
Side effects, of course. They have side effects.
It's just like every medication you take has a side effect. There is no medication that doesn't have a side effect. So now, per the method, you have a side effect.
Yes.
Yes.
Tell us about some.
Well, let us say we take, for example, the pills. The pills, it has some inconveniences. For example, okay, you need to take the pills every day, same time. If you skip one day, the efficiency reduces. You have to take another contraceptive
and you might
method.
even get pregnant.
Of course.
Okay.
When the efficiency reduces, it means you have a higher chance of getting pregnant. That means you have to add another contraceptive method onto that. You know, and also it is not destined for everyone. For example, a woman with high blood pressure, she's not advised to go for the combined pills. Okay. Yes, a woman with stroke or history of stroke is not advised to go for the combined pills. Breastfeeding woman, you know, is not advised to go for combined pills, especially in the first 6 months, because it's going to dry up the breast milk. Then, but it also has very good advantages. It helps to reduce menstrual flow for those who have heavy flow. It helps to reduce menstrual pain for those who have a lot of pain during menses. So those are also some of its conveniences. And it's very, very effective in preventing pregnancies if it's taken at the same time every day. At least less than one pregnancy in 100
women. That's very vital. Like when you talked about the pull-out method, like in the story we just saw, and this young lady, it's already regret for her, and it might put a break maybe in her career or her education, or might even cause her problems with her family, her parents, because it's obvious she's not married and she's going to be a single mom without being prepared. Can you tell us, I mean, these young girls need to understand why it is so vital for them to take full charge of their own reproductive health?
You know, it's very, very important.
Because, Doug, let me cut you. We might say that, why are we talking only to women? Why only women? Like we mentioned, the burden is more on women. When you get pregnant, you're the one who drops out of school. You're the one who has to stay up to take care of that child. Maybe the man is somewhere enjoying himself or getting more women pregnant, but you have to put a break in your career to take full responsibility of being a mother.
And one very important thing that women need to understand, women of reproductive age need to understand, is that most of these family planning methods, especially in government hospitals, are free.
Exactly.
So why not take it? Why not? Why not prepare yourself, have a child when you're ready to have? Why do you burden yourself or others? Just the other day I was for all-night call, and we had 2 women who came in labor. They had never done not family planning, never done antenatal care.
Oh my God.
You're pregnant up to 10. They don't even know the age of their pregnancies, but they are in labor.
That's bad.
That is an example of an unwanted pregnancy. It could have been prevented.
Of course.
And remember, family planning is the first pillar to preventing maternal death.
Yeah.
Because if there is no pregnancy, there is not going to be any maternal death.
Of course.
I know in our country it's very high.
It's very high.
406 per 100,000 live births. That is high. When other countries are having less than 1 or less than 5. So family planning is so important in a woman's life. It helps you to space your birth.
Yes.
It helps you to be economically empowered.
Very important.
It helps your body to be ready to have a child, because statistics show that, or research shows that a woman who has children, let's say, you know, the space between your child is less than 2 years, it increases the risk of perinatal mortality. That's for that child, even the risk of death of that child and even yourself. So you need your body to rebuild itself before you take another pregnancy. You need to rest. Your cells need to rest. You need to rest yourself. The child you've given birth to needs your attention. Imagine the child is 3 months old and you're already pregnant. When soon breast milk will stop flowing. That child is being deprived of breast milk, which is the best food for a baby. So,
and family planning, that does not only have an effect on the child, it equally has a psychological effect on the mother.
Yeah. So family planning has more benefits than inconveniences.
Yeah, it does. Now let's talk the men. Men cannot be left out of this equation.
Exactly.
What methods of contraception are available for men?
For men, interestingly, they don't have a variety like us women. Yeah. You know, for the men, you have the male condom. You know, that is everywhere in all pharmacies.
So if the man does not want you to take contraception, let him wear a condom.
Exactly. And men need to know how to use condom correctly.
Okay.
You know, they always, in most family planning workshops, they always demonstrate it using an artificial erect penis.
Yes.
You need to put the condom on an erect penis, and you need to remove it also while the penis is still erected. So, you know, they say you pens to the road. That's the top, just that we don't have 1 year would have shown. You hold the tip and then you pull it out right up to the base. You know, you leave the space for the tip because the semen has to flow inside. Each sexual act needs a new condom.
Yeah.
So it doesn't matter the number of rounds you want to go, whether it's 10 rounds, that's your...
You need 10 condoms.
Yeah, you need 10 condoms. Because if you use the same condom, you know, twice...
You can't even get in, I'm sure.
The efficiency is greatly reduced. And you see, condom too is not very effective because you see people don't use it correctly.
Okay.
And you have many cases that women come that the condom has remained in their vagina. Of course, that is already exposing the woman to unwanted pregnancy because the sperm cells will just swim inside. Yeah, so...
apart from condoms, what other contraceptive methods for men?
For men, unfortunately, they have basically two. The condom and then what you call vasectomy. Okay. Vasectomy is a permanent method.
Oh, just like we have the other one for the women.
Yes, that men don't like. Vasectomy, they go and cut what you call the vas deferens that the men don't like. They don't like doing that method because they always want to know that they are capable of having children no matter the age. Yeah, exactly. Yes.
But it is important that even if the man does not want to, because sometimes, have you had cases of young women come to you or couples come to you, like the young girl wants to have a contraceptive method, but the man is not in support. Like, let's just be doing it. We love ourselves no matter what happens, because it is when pregnancy happens, unintended pregnancy happens, that it dawns on you that you were not actually ready. I mean, how do you handle such cases as a medical doctor?
You know what? One interesting thing now, as I told you, in many health centers, medical providers have been trained to handle family planning. So doctors will hardly have those present cases of family planning unless there are exceptional cases. So, but what happens is that since you are always aware of what is happening, you have many women who will come, especially those who are married or in a serious relationship.
Yes, because most married men don't even want their wives to take
That's right, because they have very false conceptions about contraception.
Yes.
Some say it gives cancer, especially the cutting of the tube. Some say they will be sterile. Some say we'll do this. It's the white man's method to make the black woman sterile. So it's because of those things they don't want the woman to take. Yeah. Some say, for example, the implant, it's going to migrate to your heart. It's going to do this. All of that. Yeah. Then you have women who will come, they will be told about the various methods. Then they are going to say, okay, they would love to seek the
consent of their partner.
So one thing that always interests me that I always ask is that, are these partners medical personnel? Do they know what each of these methods do? Or the woman has absorbed enough because the woman is counseled on each method, its advantages and disadvantages.
Yeah.
So it's for her to make a
conscious decision.
A conscious decision. Yes. That she's been told about this method. So she makes now this decision. Now, when she goes home, will she be able to remember all those methods to explain to her man which method is which is this? And the interesting thing is that is the man that is, want to seek his permission or his consent. So
and he's not even willing to come to the medical personnel.
But it's your body, and is the man seeking consent from him? I don't know. I don't understand. I don't know. Maybe you help me to understand, because it's your body. You're seeking consent from the man. It's your body. It's affecting your body. For example, say you want the coil, and man says, no. I've heard that the coil gives cervical cancer. I want you to take implant, or I want you to take the pills. But you're hypertensive. You cannot take the combined pills. Yeah. Or the implant. You're overweight, and you're afraid that it might lead you to have more appetite to eat and put on weight. So because of what he says, you go and do it.
Yeah.
So those are one of the things that comes to saying that we should take responsibility of our reproductive
health
and sexual health.
Yeah, it is very vital. This is particularly for women. We know that we cannot leave men out of the equation, but we know how stubborn men can be sometimes. And we know that, pregnancy will be more burdensome on you, the woman. Like Doc explained, you cannot have a 3-month-old baby and you're still pregnant. It might seem great, you're enjoying it, but it has a long-term effect on your health. So it is very important that women, please, let's take our reproductive health into our hands. Take full responsibility of your reproductive health. If the man refuses, you can go ahead and still get it without his consent.
Exactly.
He doesn't even have to know. He doesn't even have to know.
I'm asking, my question is, why is he refusing? It doesn't prevent him from having good sex with you.
Not at all.
So why is he refusing? We need to understand his own point of view too. Why is he refusing?
Yeah.
Let's understand that before we can tackle it. Yes. Let's understand, why are the men refusing? So.
All right, Doc. So can you tell us, where can women get these different methods? Must they go to health centers, private, public? Where can they go to?
Almost all health centers have family planning units. If you walk on the streets, it's hard for you to see a health center without family planning written on it.
Yeah, just go there. Say you want to maybe encounter, have a family planning method.
Exactly. Yeah. The health provider is going to talk to you about the various methods. Take your health history, because it's very important. They don't just give any method to everybody. Yes, they take your health history. Then you are going to make an informed choice. That's the word I was looking for. Yes, you're an informed choice. You've been told about each method, how it works, and if it is compatible to you or not. Then now you choose your method. You're going to be accompanied to choose the method. Yes, the method is not forced on you. No, you're going to be accompanied, and you make an informed choice.
Now, Doc, I remember when we were in the university, we had some hostels mates where some young girls came. Maybe they had an implant, I'm sure, because she had something like a surgery around her hand and something was planted in, and her mother had done this contraceptive method without her consent. What is the implication of parents actually doing this on their children? Normally, I'm sure it's to prevent them from getting pregnant early or just anyhow. Are there any implications, maybe legally, for parents who do that?
Actually, the mature age in Cameroon is 21 years. The internationally is 18 years. So if any procedure wants to be carried out on someone less than 21 years, one of the parents or the parents have to be present to accompany the adolescent.
Yes.
But we need to also understand that they are emancipated adolescents. For example, if an adolescent has already given birth, she will need a family planning method. Most likely before she leaves the hospital, because if you're telling her that she's going to come to take it, it's going to be very difficult. Because adolescents actually they are not yet responsible enough to take care of themselves. So, but if you have a case of an adolescent who is sexually active but is not yet pregnant, the mother or the parent can go with that person to the health center and they choose a method for that person. Now, saying that a method is being put without the child's consent it's difficult. Yeah, it is actually not even allowed.
Yeah.
Yes. Like, I remember the other day, I consulted a 16-year-old. If you saw her, you could give her at least 20 because she really looked big.
Yeah.
And unfortunately, she came for a rape case, that she had been raped. But when I examined her, I discovered this is someone she's sexually active already. So
apparently she lied to her parents.
No. There was a rape case. She was raped. So she came with her dad. Yes. The dad wanted me to confirm whether she was still a virgin or not. Per her dad, she is still a virgin.
Yeah.
It's just the rape instant that
disvirgined
her. But when I examined her, yes, her hymen was broken.
Yeah.
But it showed that she's sexually active.
Yeah.
So I wrote my report, what I've seen, because it's not us to pronounce rape or not. We write our report. It's the judge to pronounce rape. But when the girl went out, I told the father that, but what I've seen, your daughter is sexually active. But what happened with this case, I don't deny the fact that there was a rape case. Yes. Because sexual intercourse without consent is rape.
Of course, it is.
Yeah, so, but before, she
had been sexually active.
So, interestingly, the mother came later on And I was talking with the mother. I said, you should talk with your daughter. What happened? Yes, it's a rape case. I don't deny that fact. That's why I'm writing my report, medically what I've seen. But your daughter is sexually active. True or false? She says it's true. That she put implant on the daughter.
That's a smart mom.
But the father does not
aware.
know. So I told her, I said, yes, what happened to the daughter? Because she was actually, what they described to me, she was actually raped. Yes, what happened to her was that, but you should let the dad know that she is also sexually active and that you put that so that you people can better advise her, because she is exposing herself to also STIs.
Yeah.
So in general, for adolescents, to advise them to have at least both methods. So if you're having a long-lasting method, they should also use condom, because at that age, they are sexually hyperactive.
Yeah.
You hardly find one woman for one man. They are just mixing themselves up. So they're advised to use condoms too, irrespective of the fact that they might have a long-lasting method.
Yeah.
Yes. So
anything you medical personnel tell these women, because how stubborn some of our African men can be.
Yeah, it's good to always go with your spouse or your partner to the hospital.
Yeah.
Even for pregnancy, those that can, because less and lesser men are coming for, with their wives or their spouse or their partners when they are pregnant, which is good that they should come and be part of that, because it's their child. Also good for them to come and be part of the, the family planning method. They have decided, okay, maybe they are not yet ready to have a child. They should decide together, when they think they can be ready. They should go and listen to the methods, the various methods together, and decide on which they can think they can use, yes, especially the woman.
Okay. One last question, Doc, before you go. How long can a contraceptive method last?
Each method has its duration. The implant, for example, you have various implants. The one that is 1 rod lasts 3 years. The one that is 2 rods lasts 5 years. You have the coil. The coil, you have coils that last 5 years, coils that last 10 years. You have the injectables that last 3 months, renewable every 3 months. So you have the pills. They last as long as you take. So you have each method with its duration.
Talking about pills, that just brought to my mind the Postinol, the after morning pill. How effective is it as a contraceptive method?
It's very, very good question you brought up. And I want to say, when we want to talk about contraceptive methods, that is not a regular contraceptive method.
Because we see young girls go to drugstores, get this thing to use, like the next morning after they've had unprotected sexual intercourse.
That is exactly, that is right. It is called an emergency contraceptive pill.
Okay.
It is not a regular contraceptive pill. So it means the woman does not have to be taking it regularly. But you see, some women have made it as a regular contraceptive pill, and it has consequences.
Please, let's know them.
So 1, you have delayed menses. 2, when you take it, the risk of you having ectopic pregnancy is high. Number 3, if you take it when you have already ovulated, it doesn't work.
Okay.
The earlier you take it, the better too. And you should take it before ovulation.
Yeah.
And it is only during extreme emergencies that you use. It's not something that you should be using all the time.
Exactly. Thank you so much, Doc. This has been such a learning episode. And I'm sure now, as a young girl, you know what to do, even as a married woman. Because it is said that there are more married women seeking contraceptive methods than even single people. I mean, more married women getting abortions every day because they have unintended pregnancies and do not space their pregnancies.
And mind you, abortion is not
a contraceptive method.
Yeah.
So thank you so much, Doc. It was such a pleasure for us to learn again from your expertise and your very, very, charged experience. Thank you.
You're welcome.
Now, you know what to do if you want to prevent an unintended pregnancy. If you're not ready to have a child and you are sexually active, you know what to do. Get to a health center and get a contraceptive method. Do not be a victim to an unintended pregnancy. Like in the story we saw when we began, this lady has been left with a child to cater by herself because the man will be out there. But women, like we're saying, take full charge of your sexual and reproductive health. Now you've been informed, go out there and make the right decisions. Thank you so much for watching. Until next time, keep watching Vita Talk.